movements. So the knee joint is also a synovial joint. It's considered a hinge joint or a bicondylar joint. The two articulating surfaces are the femoral condyles that articulate with the tibial condyles. Together they make this hinge joint. It's called a bicondylar joint because we have two femoral condyles articulating with two tibial condyles, primarily giving us hinge joint movement, so bending in only one plane, but we'll see that it gives some rotational movements later on. Hence bicondylar joint. Now the ligaments, there's a lot of support to help with this knee joint. We've got two cruciate ligaments, we've got two collaterals, and we have two menisci. The first is the anterior cruciate ligament we'll talk about. It arises from the anterior surface of the tibia, and then it inserts on the posterior part of the distal femur. We also have the posterior cruciate ligament that arises from the posterior part of the tibia and inserts more ventrally on the femur. So the cruciates get their names for the part of the tibia they arise from. The ACL arises from the front of the tibia, the PCL arises from the back of the tibia. And you'll notice that if we put them both together, they make a cross, hence the name cruciate, which means cross. It's anterior and posterior ligaments that make an X or a cross within the center of the knee joint. Now the functions of both of these ligaments can best be demonstrated in this lateral view of the femur, tibia, and you can see the patella that shows the front of the knee joint. Now this anterior cruciate ligament, it restricts anterior displacement of the tibia on the femur, sometimes said as restricts anterior translation of the tibia on the femur. In this fashion, when we see the femur moves forward, notice that the ACL becomes taut, tight, helping to restrict that forward movement of the tibia. In contrast, the PCL restricts posterior displacement of the tibia on the femur in this fashion. When the tibia wants to move back, the PCL helps restrict that movement. Hence, anterior and posterior cruciate ligaments help with restricting anterior and posterior translation of the tibia on the femur. Now our two collaterals are lateral collateral ligaments arise from the lateral epicondyle of the femur and goes to the head of the fibula. And this ligament, we'll talk about that in a second. Then there's the medial collateral ligament that comes from the medial epicondyle of the femur and goes to the medial proximal tibia. And so the functions of these are best illustrated in these pictures. So that lateral collateral ligament prevents varus or varus forces on the knee joint. So what that means is lateral bending or bending of the knee joint towards the wall. That's a varus force. And what this lateral collateral ligament does is help prevent that lateral bending of the knee when a varus force is applied to it. Then, in contrast, that medial collateral ligament prevents valgus forces on the knee joint, which is forces that will bend the knee more medially towards the midline of the body. So the MCL prevents medial bending of the knee joint when a valgus force is applied. And then our menisci. These are fibrous cartilage or fibrocartilage wedges that are found within this knee joint. The medial meniscus is illustrated there in purple, and then the lateral meniscus as well. And these menisci help with absorption of shock and help keep the femoral condyles on the tibia when the knee is bending. So the movements of this knee joint are extension, flexion, and then we'll discuss this rotation.